Hello, and welcome to the U.S. Chamber Foundation's Path Forward series. If you're a regular, welcome back. And if you're new to the series, thank you so much for joining us today. Since the beginning of the pandemic, we've done a robust series on a return to health and a return to work, and have been lucky to speak with some of our nation's foremost experts about how and when we'll return to normal. Now, with multiple vaccines approved and more on the way, we're all beginning to see a light at the end of the tunnel. But there are still challenges ahead, and as we're all reading and seeing and experiencing every day, namely distributing and administering these vaccines so that the whole population gets vaccinated and protected is the challenge on the horizon. This task, as you all well know, has largely fallen to the individual states to figure out which groups to prioritize and how to distribute the vaccines at scale. As you know, as you're watching, this has resulted in varying levels of success among the states, with some states really surpassing expectations and others lagging behind. So, what strategies are working? What isn't? What can states learn from each other as they navigate this critical effort? Joining us to discuss this national effort that's playing out across the country is West Virginia Governor Jim Justice. West Virginia has spent 3 weeks as either the number one or number two state in the nation for vaccine doses administered per capita, with more than 85% of its delivered vaccine doses administered already. Governor Justice is going to help us unpack what's worked in the Mountain State, what other states can learn from their success, and how West Virginia is engaging the private sector in that effort. So let's get right to it. Welcome, Governor, and tell us how the fine people of West Virginia are faring in this pandemic.
Well, Suzanne, I appreciate you having me, and the great people of West Virginia have done one thing and through all this, and they have stayed together. You know, I've come in front of them every other day, Monday, Wednesday, and Friday, or prior to that every day. And we've been completely transparent. We've told them the truth. We've depended on West Virginians to step up, and they've done it. And through all this, you know, we've hurt just like those all across our nation and all across this world have hurt. But at the same time, we've stayed together. We're not protected by an ocean in West Virginia, and we're within a rock's throw of 2/3 of the population of this country. But yet our numbers, our deaths are way, way, way less. And we've done that by absolutely staying together, working hard, making the economics work, listening to the experts, and pushing the right buttons and making things happen in West Virginia.
Well, that's wonderfully said. And then let me unpack a couple of those pieces. Let's start with, how did West Virginia become a national leader in COVID-19 vaccinations?
Well, Suzanne, to tell it like it is, and I don't say this braggadociously, but just think back. I mean, we were first in the nation to test all the rest of the nursing home residents and all the staff. We were first in the nation to get all of our nursing home residents and staff vaccinated. And now we're probably first in the nation in getting them not only their first shot, but their second shots as well. Then right behind that and everything, now we've become first in the nation in administering and getting the vaccines out to the people. And there's so many other things, first in the nation in personal income growth, and on and on and on. But if it really boils right down to it, West Virginians are always common sense, practical people. Now, I would tell you, Suzanne, from my standpoint, and I've got to tell you this story real quick, but my dad, I was probably 18 or 19 years old, skinny and brown hair. And I looked right at my dad and said, "Dad, there wasn't anything I can do." To this day, I don't have any idea what it was that we were talking about. Well, he played a little bit of football for Purdue University and was an aeronautical engineer there. His chest was as big around as my legs at that time. He jumped all the way across the desk and grabbed me by my shirt and just slammed me down on his desk. And he said, "Damn you, there's always something you can do, and you better damn well always remember that." Well, that's the way I am, and that's the way I operate. I'm not in this position as a politician. I'm in this position to serve. I'm a business guy. And I've seen all the times when people try to make more of something than they should. We didn't do that in West Virginia. We just got to work, and we knew this was all about age, and we knew we had to develop an all-encompassing strategy. with our local pharmacies, our local health clinics, the National Guard, and we needed to put shots in arms. And so we got after it right from the get-go. And I very proudly can tell you that last week, with vials having more vaccines in them than what we were told they'd have in them, we put in arms 108.1% of the vaccines that West Virginia is receiving. And we've done it for weeks after weeks and everything. And we're going to continue to do that. We just need more vaccines.
Okay, so I have two follow-up questions to that, Governor. The first is, I love the Jim Justice spirit. I love the story about your dad, all of it. What's in there, though, that other states can replicate? If they're not in the Mountain State and that's not in their DNA, what can they learn from how you've gotten this done?
Well, they need to get the bureaucratic thinking out of the system because people are dying. To sit back and try to develop a system and work on it with 18 experts or 1,800 experts and everything, with people dying, just isn't going to get it. That's just all there is to it. And the next thing they needed to do is understand that people all across this country, whether it be in New York or Los Angeles or West Virginia, no matter where it may be, people go to their local pharmacies. People go to their local doctors or their local health clinic. You had to take this to the people. And this model can work anywhere in this country. And we're slowly moving to this. But in the last few weeks, and just to tell it like it is, a bunch of people have died because we were sitting with vaccines on shelves and they should have been in people's arms.
We, the United States, not we, West Virginia.
I'm sorry, I didn't get the last one.
You mean that's happening in the United States, but it's not happening in West Virginia.
No, there's no way it's happening in West Virginia. I told our National Guard general and I told our coronavirus czar, because just to tell it like it is, from time to time, I've got to do my job and I've got to sit on people just a little bit to get them to where I want them to be. But I told them the biggest fear that they had was on the door and a little guardsman or lady standing there saying, General, there's a truck out here and it's got 92,000 of these vaccines in it. And I don't know where we can put them because the warehouse is full. Now that's what's happened all across our country. And really at the end of the day, that didn't happen in West Virginia because absolutely I saw it coming and we absolutely made it not happen in West Virginia. And that's the shame that's happened across our country.
It seems from the outside, Governor, that another thing you've done right in West Virginia is if you started with an approach and you got new information, that you would adjust as you went along, like we would in business in real time. And so you started with the first come, first serve clinic, but now you've gone to a registry that really gives individuals a better sense of when it'll be their turn. And so what did you learn from that process?
Well, Suzanne, not to say by any stretch of the imagination that everything is perfect in West Virginia because, just like the Trump administration, they deserve so much credit because they started from scratch. Mm-hmm. Now, the Biden administration is starting with a tsunami. So we need to be really respectful to both presidencies and for all the good that they're doing. But West Virginia by no means has just come right out of the blocks perfect every time. We learned really quickly, when we tried a first come, first serve basis, that we would run out of vaccines and then have seniors out and basically exposing them to even greater peril. And so from that, we quickly adjusted and pivoted. Now we've got a new system in place that maybe the first in the entire country that basically calls our people, sets up appointments, emails, texts, and on, so that absolutely it's a much more orderly approach. But, I keep going back to the same thing. If we had, this I know is hard to imagine, but in West Virginia, we've got this so down pat that really, if we had an unlimited supply of vaccines, I'll promise you in 15 days, everybody that's age 65 and above in West Virginia, we'd have them all vaccinated. That's all there is to it. We have got it just that down pat. We just can't get the vaccines.
So, Governor, if you were estimating when you think you will have enough vaccines, When do you imagine the entire state is vaccinated?
Well, I mean, Suzanne, that's a $64 question, and you know it. And I've had many conversations with Chef Zients, and he's doing a good job as our new coronavirus czar. And I give so much credit to all those that worked so hard with the Trump administration in this. But with all that, I can tell you that our vaccines are increasing. It is promising that more and more different company vaccines are coming online. But the sadness, unequivocally, is just the fact that by the time that we get more vaccines and we get the supplies that we need, we're going to lose people. And to me, that just jerks my guts out, because it's sad, but at the same time, you have to commend the effort for us to have vaccine, period. But this is tough stuff. I mean, there's nothing easy about this job, and there's nothing easy about this pandemic that everybody's going through.
Now, when you and I have been together in the past, we've talked about how important education is, particularly in West Virginia, and what we do to close the learning gap in different places in your state. And certainly this pandemic and the shutdown that has ensued has really been really difficult on children, on educators, and in a lot of ways makes this education gap work. So talk about the schools in West Virginia, both getting them open and also how you're prioritizing educators in the vaccine rollout.
Well, I mean, it's just as simple. We developed a color-coded map, that we started with way back when, going through the first semester of this school year. It worked, and it worked marvelously, to tell you the truth. We had certain counties that didn't have outbreaks, and West Virginia is a very, diverse state, and we had counties that could, were red and didn't have any business being back in school, and they could go remote. But lots and lots and lots of counties, for the most part, at times, all of our counties, but then many times, only one red county or whatever it may be, and they weren't in school. And we've modified that to where we weren't going back. We're going remote under orange, but it worked, and it worked well. But now we know from the science that especially all those kids from 8th grade and down need to be in school, and they're not spreaders. And we know we can't make it perfect, and we cannot do that. We made all of our teachers and service personnel essential. And then what we did is we offered all of our teachers and service personnel 50 years of age and older, and we vaccinated all of them before we went back to school with our 8th grade and down in all counties. And now we're down to 9 of our 55 counties that are red, and all of our 9 through 12 are back in all of our counties in the state other than 9. And we know that the remote learning, for all practical purposes, has not been great, and to say the very least. In fact, it's just plain not worked. And with all that, I guess it's better than nothing, but there's nothing to replace in-person learning. And there's so many aspects, so many special needs kids really hurting, so much, from the standpoint of potential abuse, that we need eyes on kids. So many kids that are struggling with their curriculum and everything from the standpoint of their classes. And if that's not enough, we have everything from hunger to whatever it may be. Now, we can't make it perfect, but we've stepped up, and we have made it as safe as we know it can possibly be. And I commend our teachers and our service personnel. You have those, union bosses maybe that are pushing, programs or things that we shouldn't even be talking about. But at the same point, from the same standpoint, for the most part, our teachers have stepped up, and our service personnel, and are doing a good job.
Well, it goes back to the state-by-state difference, because I live in your neighboring state of Virginia, and the schools are in a much different situation.
Well, I hear through the grapevine that West Virginia's got a good governor.
I've heard that too. We're thinking about having him on this show one of these days. Governor, you just mentioned essential workers. And so, we hear some frustration from employers around the country about how different states are prioritizing which essential workers are eligible for the vaccine. And I wonder if you could talk just a little bit about what consideration you're taking in when you're thinking about essential workers.
Well, I mean, Suzanne, when I think there's a book, Don't Sweat the Small Stuff, and it's all small stuff or something like that.
Yeah.
I mean, really, at the end of the day, and I can tell you an economic story real quick about West Virginia, and I'll do that in just a second, but all workers are essential in my book. But you can't make everybody essential at this moment. But that's what I want to have happen. I mean, it is amazing if you'll just think about the people that worked in the grocery stores and the people, the first responders and on and on and on. It is just unbelievable, the people and the courage that it took, just for a lady or a man to get up and put his clothes on and kiss his children or her children goodbye and go to work at the hospital and go right into the middle of the fire. It is unbelievable what people have done in this terrible, terrible killer and pandemic. But one of the things we did in West Virginia from an economic standpoint that was really neat, and I met every day with our revenue people, and over they gave me in the beginning a lot of doom and gloom. And I knew in my heart that we had shut down things in West Virginia, but we did not shut down our essentials, and we did not shut our engine down. And we kept moving, and lo and behold, West Virginia ends up running across the finish line in a pandemic year with a cannonball to the stomach like nobody's business. And right behind that, with moving the income tax filing date into the next year, from a fiscal year standpoint, our income tax filing date went from April 15th to July 15th with our fiscal year ending June the 30th. You talk about a mess, but some way, somehow, we juggled the balls and we made it happen economically in West Virginia by just using good judgment again. So all this can be done. You just have to absolutely just step back and think about it in a practical manner and everything, and you can get it done.
While we're talking about employers and workers and essential workers, as we just were, we get questions a lot about, is there a role for employers in kind of hosting vaccination clinics? Do you think that's true in your state?
Well, I think it's a little bit premature, but as we get more and more and more vaccines, Johnson & Johnson coming online or other companies coming online, and we ramp up production and everything to where we can very quickly get this job done throughout the entire land. Employers stepping up and having their own clinics and so on like that, it's a good idea. And I'm sure that we'll have many, many in West Virginia that would be willing to step up, and they'd be willing to step up right this minute. And that, Suzanne, and it's just a matter again of just, it's premature from the standpoint that we just don't have the vaccine supply.
Yeah. And I'm sure Steve, our good friend Steve Roberts, our mutual friend at the West Virginia Chamber, I'm sure is standing by ready to help. Let me switch for a minute too. I mean, you've been very passionate and eloquent just in the few minutes we've been together about the suffering in your state, both the health suffering, the lives lost, and also the potential for business suffering and economic harm. And, here in Washington, we're consumed by the next round of pandemic relief. You've made some news by saying that Congress should go big. What do you think has to be prioritized in this next round?
Well, I am not an advocate of bailing out pension plans in cities and states. There are certain things within the stimulus package that I think you're referring to, that I surely would not be a proponent of. But I have not had the liberty to be able to read. But I can tell you this, Suzanne, that I've run hundreds of businesses and employed thousands of people, and and I really truly have not seen many really big time problems that you can cut your way out of the mess. Now, it doesn't mean that we should not be prudent in what we do, but what we have done thus far, and I and I've conveyed this, to our past president and everything, but how our stimulus package was held up by Speaker Pelosi and maybe the Republicans fighting back and forth, and what was going on, on a national scene, and what goes on in Washington almost daily, and it just continues to get worse and worse. When are we going to awaken to the fact that first and foremost, we're not Republicans and Democrats. First and foremost, we're Americans, and we need to be working that way, because if we don't watch out, this kind of craziness is just going to cannibalize us. So with all that, to me, I absolutely believe that we need to go more aggressive in a stimulus package than less aggressive. And the reason I say that is just this, is absolutely, if we were more aggressive and too aggressive, and there were some dollars that really became wasted dollars, it would be a terrible shame. But absolutely, if some way, somehow, we kick-started our economy and we helped all those that are out there trying to figure a way to pay their power bill or their rent or their car payment, and got them right side up and everything. People that didn't have a thing to do with losing their employment and everything. If we were able to achieve that, this country's economy would explode to the upside. So from my standpoint, and how I've done everything, and from my standpoint, is I think we go big, and we go now.
Well, you have a fan, of course, in the chamber, and what you're talking about in particular, in our belief that the chamber isn't a Republican institution. It's not a Democratic institution. It's a business institution, and we're about getting things done. And we'll work with anybody who wants to get things done, right? That's where we sit.
Amen.
So running through a couple of just quick ones for you. I think from the outside, when we think about controlling the pandemic until we're all vaccinated, it seems to come down to three things. One is the restrictions that allow the 6 feet distancing and social distancing to take place. One is testing. And of course, one is masks. So going through them just quickly in an order, let's start with restrictions. Certainly, we know it's been really hard on small businesses in particular to have to shut down, to have to lock down, to have bans on indoor dining, all of the restrictions that we've seen and that governors and others have decided are necessary for the public health. How are you thinking about restrictions on businesses and opening hours over the next several months in West Virginia? Well,
Suzanne, that's been a very, very difficult decision with a tremendous amount of pressure, to close this or mitigate this or do this or that. From my standpoint, if I knew beyond a doubt, my medical team would have advised me that something needed to be closed because it was a potential danger, and we know for sure this is where this is coming from, well, then I would think it probably ought to be looked at to be closed. But they can't do that. That's the whole thing. They can't do that right now. And that's why I have resisted closing anything for all practical purposes since way back when. Because right now, this is coming at us in so many different directions, it's unbelievable. As far as wearing the mask and the testing, without question, we ought to continue to do exactly just that. As far as the social distancing and using our head, as far as, doing anything and everything we can do, to go get tested if you have a little sniffle or whatever it may be, all those prudent things, absolutely, I preach every single day.
That's great to hear on both levels. We have a number of questions coming in from the audience I want to get to, but first let me ask you to speak right to the business leaders in the audience today. What do you want business leaders to know? What do you want them to say? What is it that you want them to do?
Well, from the standpoint of our business leaders across this land and across this world, first of all, the U.S. Chamber does an amazing amount of work and everything. We're very, very blessed to have Kathy Beckett and Steve Roberts and all the people here that do great stuff. But really, when it really boils right down to just this, there has been no playbook for this. Absolutely, people need to think with common sense and think from the standpoint of what are we really attacking? Where does this disease really attack? Well, it attacks the elderly. It's all about age and everything. Do we need to be in school? Of course we need to be in school. And from that standpoint, then what do? Do we sit around on our hands and study it, or do we go to school? We got to go to school. And from the standpoint of our livelihoods and our businesses and how we have adapted to live with this, we have got to stay open. When we shut down the economic engine of this country, it is catastrophic beyond belief. And all of us know that. All of us know that. But absolutely the whole thing that we've got to remember is just one thing and one thing alone. We're all in this together, are we not? I mean, really and truly, we're not, Democrats and Republicans and independents. This business of one-upping everything and trying to think this thing through from the standpoint of some level of divisiveness, this nation has become divided in such a way that's unbelievable. And I don't know if that's a promotion of social media where everybody's got a voice or all the different things that are going on, but we are way too divided.
Yes.
This country, go ahead, I'm sorry.
No. I was just agreeing. I'm sorry. You were getting an amen from the congregation there. Sorry, I didn't mean to interrupt you.
No. I mean, but I from my standpoint, Suzanne, it's as simple as just this, is with the nation going in the way that we're going, America is so resistant, and America is so absolutely tremendous in such ways that we believe what can't happen to us. Bad things can't happen to Americans. A lot of people wouldn't wear masks because they said, I'm not going to get this. I tell people all the time, whether it be 35,000 or 50,000 are dying on the highways, not everybody, now I don't know of any person that gets up in the morning and says, oh, today I'm going to get killed on the highway. But it happens, and America can deteriorate, and America can end up with lots of problems. If we don't get our act together from the standpoint of being divided as a nation for all kinds of reasons, from the standpoint of wealth or from the standpoint of race or Republican and Democrat, we have got to get our act together, and especially get our act together in Washington. Well,
from your lips to God's ears, Governor, I'm going to ask you some panel or audience questions here about the pandemic, but if you'll permit me one off-topic question. I just asked you what you wanted business leaders to say, support, do about this pandemic, and you gave a wonderful, passionate, eloquent answer. If you could look into this audience and help them understand one thing about the key components of energy production, which I think is another misunderstood issue that you speak very passionately and eloquently about, what do you want our audience to understand about energy in the United States?
Well, again, now you're talking about a guy's family's been in the coal business and a guy's from West Virginia. You're going to be surprised to hear that this guy, what he believes is just this. We all want the cleanest air and the cleanest waters beyond belief. Every day when you go outside in West Virginia, it's just that. But absolutely, without any doubt, all of us need, and I hate to say it this way, but pull our head out of our butt in a lot of different ways and realize that today, if you think today that you can do without coal and natural gas in this country, you're making a big mistake. West Virginia and Jim Justice supports all the alternatives and supports a way of life that as we go forward, we have got to have abundant, cheap, clean energy. That's the three ways that civilization will progress, absolutely without any doubt. It used to just be abundant, cheap energy, but now it's got to be abundant, cheap, clean energy as we go forward. But today, there's no point in America just blowing their legs off because the world is not ready for America to just blow their legs off. And so from my standpoint, and I'm sure there's lots and lots of different opinions. I want everything that you want, meaning others that have a different opinion, but without any question, we were leading the world as an energy power. And now, if we don't watch out, a little stumble here and a little stumble there, and then you know what you'll be hearing? Because you'll be hearing brownouts or problems all over our country and everything. And you'll be hearing, drill, baby, drill. Let's just be smart. Let's just have a great strategy and everything and going forward, and we will really make progress because there's ways to really do this just as well.
I appreciate you speaking up about that. So let me move to a couple of audience questions. Here's our friend Steve Roberts. He says, the governor is doing a great job, not a good one, a great one. And does West Virginia get the national media attention it deserves for its successes?
Now, did you ask me that question?
I don't know. Steve asked it. I mean, I would, if he had asked me that, I would say, no, I don't think it does. And I think this story and the success is, we've got to get it out there. And it's part of why we're doing this program.
Well, Suzanne, just think about just this. You've got a state that's located within 600 miles of 2/3 of the population of the country with 4 of the most beautiful seasons that could ever be. You've got people that are craftsmen that know the difference between right and wrong. They're faith-based, they're good people, low crime. You've got natural resources like you can't imagine in West Virginia. And you've got a state that's handled the pandemic and all the economics and everything that's going on and handled it really well. You've got a state that's already embarked on a tax situation, that makes it absolutely welcoming and is diversifying in every way. West Virginia, honestly, has become the diamond in the rough that a lot of people miss. West Virginia is a place that is phenomenal as to what's going on right now every day. People are calling from everywhere. Hyperloops on the way, on and on and on. So I personally, I guess I'm really selfish, but I would just say this. The reason that I ran for governor is just one thing. I love West Virginia beyond good sense, and I love its people, and we kept getting the bad end of the stick a lot of different times. We're the blunt end of a lot of bad jokes and constantly fighting Mississippi to see who was going to be dead last in the country. Well, things have really changed, and now people really see West Virginia for what it is. West Virginia abounds in really smart folks too, and so I'm really proud of it.
Can I get dual citizenship, do you think?
You can. Well, no, you can't, because if you're not willing to come here wholeheartedly, we're just going to just say no, you can't come.
All right, got it. So let me ask you a question. I think Steve's right about the success of West Virginia here. Are other people, other governors, other health departments calling you, figuring it out, contacting you, saying how is this working? What can I learn from you?
Oh, sure. Yesterday I was on the call with all the governors, and, Asa Hutchinson, wanted me to tell all the governors, what's going on in West Virginia and all that. But, and that's great. And, we'll surely do it. We'll surely pass on any tip that we've got going on in West Virginia to anybody to help. But we don't profess to have all the answers. And I don't want to ever come off egotistical in any way. I want to be thankful. And the one thing that West Virginia people are, they're loving people, but they're appreciative people. And that's the way I want to be too.
So another question we have from the audience here, did West Virginia do a trust campaign, since there seems to be a hesitancy or even aversion with a high percent of adults saying they don't want to get the vaccine? I know you took it publicly as a sign of leadership, but did you do a trust campaign of some sort?
Susan, I think I got your question. I may have misunderstood just a little bit of it, but I took the vaccine right off the get-go and everything in front of everybody and on the briefing and everything, because I wanted everybody to see that I really trusted the FDA and the CDC and all the medical community for what they were doing, and I think they've done great work. we've had, just like any state, we have reluctancies and everything as far as people taking vaccines. But, when I was growing up, you can tell by my white hair, there was a TV show called Laugh In. And on that, they had a rabbit that they called the Dumb Bunny. And I would just say this, for those that are out there all across our land, if they're not taking the vaccine, they're dumb bunnies. Because if you'll just step back and look at the people that are dying, and they die very, very quickly, and they die a miserable death with their loved ones not with them and not being able to breathe. I mean, the risk of this vaccine is next to nothing, and they need to be taking it.
This is another audience question. It's a little bit more technical, but we do get it in a lot of ways at the chamber too. So I'm curious your answer. This question is, have you trained non-medical personnel to give the vaccine?
Well, I honestly, that's maybe a little bit above my pay grade, but I can tell you this, that if we get to the point in time where we have the vaccines and we're able to get them into people's arms and everything, we have contingency plans to recruit medical students and on to try to get to a situation to where we can get this, facilitated and out there as quickly as possible.
Okay, I'm going to ask you two last questions because I know you have a state to run, and these might be one's a little personal, and I've asked a lot of people this. What have you learned about yourself in this pandemic?
Well, I really believe this, Suzanne. I believe the good Lord put me in this position. I believe the good Lord made me Jim Justice for a reason. And I have not looked at this as any hesitancy or reluctancy. I've looked at it as an honor. It's hard. You worry. You've got a lot of sleepless nights and everything. And I read every name, the people that have passed away every day. I actually read, their gender and their county and their age and everything. And I do that out of total respect. And it's tough. It's really tough. But I truly believe that we're going to get through this. And I think it's a blessing, that I've had the opportunity to be at it. And I hope and pray that I won't let people down.
I'm sure you won't, sir. So last question. This has been a difficult time for many people around the world, and you called it a cannonball to the stomach. And I think, if anything, that might be understating it a little bit. I mean, it's really obviously been very difficult. And yet I think people look to leaders like you for optimism. And, I personally believe that optimism is a leadership trait, that you have to believe it can get better and work for it to get better. And so what makes you hopeful right now? What are you most optimistic about right now?
Well, Suzanne, we're going to get through this. There's no question whatsoever we're going to get through this. And whether it be the variants or whatever it may be, we're getting better. And whether it be we're going to use all the prudent practices or we're going to vaccinate our way out of this, we're going to get through it. And what we've got to do is we've just got to stay together, and stay together. Really dividing in a lot of different directions only fragments us and only makes us worse. It absolutely exposes us beyond belief. But we all need to know that pulling this rope, the only way that we're going to get there is we got to pull the rope together. And that seems so simple. And it's happening in West Virginia, but it's not happening across our nation. And so with all that being said, I am optimistic without any question. I am honest. I carry myself with great honor from the standpoint of I always want to tell you the truth. I'll make a lot of mistakes, but I am telling you with all in me to God above, we're getting through this. And this day will pass and the future will be unbelievably optimistic. Right now, there is so much money that's going to be flowing all across our land. If we'll just manage ourselves and manage it properly, America will rise out of this like you cannot imagine. And so I am tremendously optimistic about the economy going forward and absolutely optimistic about the health and well-being of our citizens if we can just hang on for just a little bit longer and we can get our herd immunity and our vaccinations and all to a level to stop this chain and shut this thing down.
Well, listen, you're up to the task. The West Virginia is lucky to have you. The country's lucky to have you. I, for one, cannot wait to get back to wild and wonderful West Virginia. I'm pushing for dual citizenship. I'm not giving up on that, Governor. But I really appreciate you being with us today so much.
I'll reconsider. Suzanne, I'm reconsidering right now, and I have the ability to pardon you for your past mistake and everything, but come on down.
Well, listen, God bless you and the fine people of West Virginia. We look forward to seeing you again very soon.
Thank you so much. Appreciate you.
Thank you. To the audience, thanks so much for tuning in. We appreciate it. If you've missed other episodes, you can find them at uschamberfoundation.org or on YouTube. So please, in the meantime, take care of yourselves, take care of each other, and we'll see you again soon.